teaching methodology that you're using should be positive in nature, such that the child wants to run to you, not run away from you. Hi, I'm Dr. James Partington, and I've been working in the field of autism and developmental disabilities for over 50 years. And I'm known for my work in the area of autism treatment. I've developed several assessments, including the assessment of basic language and learning skills revised, and also the assessment of functional living skills, which has been used on a worldwide basis to help parents and practitioners identify skills that individuals with developmental delays, and autism is one of those developmental delays, identify skills that an individual needs to acquire to be able to, for the ABLES are, be able to learn from their everyday interactions with others, and also with the AFLs, the Assessment of Functional Living Skills, to be able to identify skills that are necessary for them to be able to live as independent of life as possible. Actually, when I was 17, I took a course in college. It turned out that it was a psychology course. It turned out to be a course in behavior analysis. And I didn't know what behavior analysis was at that point in time, but as soon as I started studying the material, I realized that it was a scientific approach to understanding behavior and realizing the impact of the environment interacting with an individual that tended to either foster or not foster someone to engage in certain types of behaviors. And when I started to realize this is in the 70s, that I realized this is a real powerful bit of knowledge, scientific knowledge, that could be used in an applied way to try to help solve a lot of human conditions. So I ended up actually working in an institution for a short period of time with adult psychotic males, and we're using token systems to reward them for doing different types of activities, socially engaging with others. And that was interesting. But then I had an opportunity to start working with children with multiple disabilities. And when I went into the classroom, I remember asking the teacher, I said, okay, so these are my two children you want me to work with, Jenny and Manda. And they said, what would you like me to do with them? And the teacher, who is also a behavior analyst, used some very technical terms. She said, establish yourself as a conditioned reinforcer. And I said, oh, okay. I knew exactly what that was. I was 20. And what that meant was, interact with them in a way such that they want to keep interacting with you. You know, make yourself and them interacting with you, make your behavior, how you interact with them, what you do with them, become important to them, such that they were willing to work and do the things that I'm asking them to do so that I could teach them the skills they needed to learn. And there was one little girl, her name was Jenny, who, when I started working with her, you know, all of a sudden, you know, she had multiple disabilities. She couldn't stand up on her own. She had cerebral palsy. But when she'd see me walk into the room, you'd see her little body kind of going like this and smiling when she saw me and giggling. And it was like, wow, this is very powerful. I loved working with her. She loved working with me. And then I realized that I was able to teach her and other children skills that other people just didn't have the ability to teach. The ABLES R, or the Assessment of Basic Language and Learning Skills Revised, that's what ABLES R stands for, was really my first major contribution to treatment. That, along with co-authoring a book on teaching language to children with autism. With those two documents, it's helped parents and teachers realize the importance of teaching different type of language skills to children. I think one of the problems that was present before I developed those materials was that a lot of times the people who are working with children would approach language from a perspective of just, do they understand language, or what speech and language pathologists call receptive language skills, and also about just talking, using words. But when it comes to using words, that's where there was a real problem, because people would talk about receptive and expressive language skills. But what my work has really done is help people to realize that there are different types of expressive language skills. And just because you say a word doesn't mean that you can use that word under all different types of conditions. You know, number one, do you understand the word that's being said to you? But can you use that word? Can you actually vocally imitate it? Can you say that word? That's an important part. Can you use that word to get access to things that are important to you? Can you use that word to label things that you're seeing? Can you use that word when you're talking about things that you've experienced? And so it's not just about receptive language and expressive language, but it's about all the different types of what we call verbal behaviors, which is asking for things, naming things, repeating what you hear, and then talking about things in their absence, which we call intraverbals. But that's what my major contribution has been, is teaching people about the different types of language skills. But another major aspect of my work has always been about teaching people to realize the motivation behind why a child should be interested in learning something or interacting with others. Because what happens is, you have these children, they have these language deficits, but oftentimes, as you start to teach language skills, they may still not be that interested in interacting with others. But why should they interact with others? It's if something in that interaction gives them something back. My most impactful, there's been a lot of work I've been doing, so it's kind of hard to answer that. But I'd say that the development of the assessments that I've created to measure very, very specific skills, so you can make sure that people are addressing all the different types of skills that may not be obvious to most people. Most parents, if you look at a young child and they say they want to get them ready to go to school, like kindergarten, they want them to be successful. And they say, well, they don't know their numbers, their colors, their shapes, and their letters. Well, yeah, they may not know that, but do they know the basics? Do they know the names of objects? Do they know adjectives to describe certain characteristics of objects? Do they know a wide variety of action words, verbs we call them? Do they know how to talk about things? Do they know how to ask for things? Do they know how to ask for information? Can they tell you about things that they've experienced? And see, again, many times, simple concepts that people want to see a child develop, like numbers, shapes, colors, and letters, just isn't sufficient. Because when you look at a typically developing child, by the time they're 4 to 5 years of age, they're like little geniuses. A typical child will ask you information, they will be paying attention to everything you're doing and saying, and they're learning through their everyday interactions with others. They're watching what people are doing, they're watching how people are responding, they're listening to what they're doing, and they're using their skills to interact with others. But if you don't pay attention to all those little skills, and you just look for the big skills, numbers, shapes, colors, and letters, you're really missing the foundational skills that a typical child has to be able to participate in a regular education setting and learn from their everyday interactions with others. So I think the most impactful part of my work has been to get parents and teachers to focus on very, very specific skills that are foundational, teaching the simpler skills and then gradually teaching more and more complicated skills, pulling them together. We need to make sure that we've always been working on getting them to be more independent in every way possible from as early as possible. Because if you don't teach children to do things for themselves, somebody's going to have to help them do it, or you have to pay somebody else to do it for them. And that doesn't lead to independence. And so I always want every individual to be as independent as possible, as capable as possible, and to get the most out of life, to enjoy interacting with others and doing all the activities that are available to everyone else in this world. Because when it comes to the diagnosis of autism, it's based on 3 major characteristics, and one is delays in language skills, the second is delays in social interaction skills. But when you don't have good language skills, how are you going to socially interact with somebody? So inherently, you have to work on the language skills first to make sure that the child understands what people are saying to them. They can ask for things that are important to them. They can tell you about what they're seeing and hearing, but they can also talk about their experiences, about what they've done in the past or what they'd like to do in the future, and be able to ask for information about what's going to be happening for them. So my major emphasis has been on language development using Skinner's analysis of verbal behavior. And that's what I'm known for, is applied behavior analysis treatment, which specializes in the verbal behavior approach to teaching language with autism. There are many people now who are calling themselves behavior analysts because they passed a test that said they meet the minimum requirements to be a behavior analyst. In other words, they can answer some basic questions about the field of behavior analysis, but are really not effective or have not had adequate training in terms of how to work with individuals with autism to produce the most beneficial results for the children. And so it's buyer beware. I think that's one of the things you have to ask. I think there's been a lot of children being diagnosed with autism lately, and there's been some questions about whether or not truly the incidence of autism has been increasing. And also, yes, it has been. It's not just diagnosis issues. There are a lot of kids right now who are showing signs of what we call autism spectrum disorder, which is based on what we see them doing or not doing. As far as misdiagnosed, I'm not so much worried about that. What I'm worried about is not being diagnosed or not referring children for treatment early on. When a child goes to a physician or a developmental pediatrician, the parents might start to notice that there's something different about their child, or they may be concerned that they're not developing very well. Sometimes parents notice right away there's something significantly wrong, but a lot of times it's very questionable, not quite sure. But of course, it depends on whether they've had a child before or not. If this is their first child, they don't know what to expect. If they've had another child who's gone through the normal developmental process, they might see it a little bit faster. But then also, there's always this kind of think optimistically that parents and family members, extended family members, oftentimes encourage, well, Uncle Joe, he was kind of late to talk and now you can't shut him up. They say, you hear a lot of things like that, or just wait, children often don't speak for a while and then they start getting it later, which is true. Unfortunately, nowadays with the high rates of incidence of autism being a reality, if a child even shows signs of not using skills that other children are using around, that should be concerning to the parents. That should be concerning to the professionals. And if you're going to make a mistake, there's different types of mistakes. You can make a mistake of making wrong diagnosis, saying it was autism and it wasn't, or saying that it was autism and it really wasn't. I think you got to be careful with this and say, if there's any concern whatsoever, don't hesitate to start taking a look at getting some other people involved in interacting with the child to see if we can get these skills being developed that you would expect to see. Parents often are susceptible to listening to people who are promising them hope, right? And I think that's, of course, you want to have hope and you should have hope, but you also need to say, why should I trust this individual's input to me? What really have they done in the past to effectively have outcomes for similar children than my own? It's not just about specially trained teachers or therapists, but it's also parents. Parents are with their child all the time. And of course, parents want the best for their child. And I think one of the things that happens is oftentimes, if you're a parent of a child and you've not seen a child with developmental disabilities, delays, what you were expecting, it was a child who was just going to naturally start learning very quickly. All of a sudden, that's not happening. And that's scary for the parent, because what's going to happen to my child if they don't learn to learn like the other children? And so I think one of the most important elements of my work has been to incorporate parents into the teaching. So when you read my documents, my books that I've written, I write them not only for therapists and professionals, but also for parents. I put them in English terms, regular everyday language, not in technical terms, because a lot of the resources that are available to parents are so technically written, like conditioned reinforcer. What is that? They don't know what that means. Learning could and should be fun. And so we want to make sure that all of the emphasis that goes into, like from my work that I share with others, has been to make it possible for parents and teachers to work together. So for instance, if you have an assessment that lays out this is what the child should be working on, and these skills are more difficult than these other easier skills, and the parent says, well, I want them to do these skills, and say, well, yeah, that's good. You want them to do that, but really, they can't even do these simpler skills. So before we start teaching the more difficult skills, we need to focus on the easier skills that they're able to use right now. But it helps parents to realize how the developmental process for a child needs to focus on specific skills right now that are going to pay off for the individual child at this moment, as we work to develop these more difficult skills that parents are often looking for. So it kind of helps them to be patient, realize we have a way to get there, but we've got to work starting in a very systematic way such that we don't frustrate the child. Because if you try to teach a child something they're not ready to learn, it's no fun for them. And oftentimes their behavior is going to tell you that it's time to get away because I can't be successful. So we want the child to always feel successful, and we want the parents to feel successful in teaching skills to their own child. Because if they try to teach something too hard for their child, the child's not going to develop that skill. The parents aren't going to feel good about it, and then they're saying, I don't know what to do. So for me, parent education, showing parents how to teach in a positive way that focuses on the correct skills at the right time, that really helps parents and educators work together for the best interest of the child, so you get the best outcome for every child. Oftentimes in many of the medical fields, the people who are working with the child often say, well, let's wait another 3 to 6 months and see what happens. Well, the problem is 3 to 6 months passing, typically developing children in 3 to 6 months are picking up massive amounts of skills rapidly. And so if they are behind and you don't start trying to work on accelerating their development of skills, what is happening is they're getting further and further behind the other children. And then it's even harder to get caught up. And see, this is where even under the best of circumstances, with the best treatment we know, slightly under half of the children who receive early intensive behavioral intervention, which is educational services, slightly under half can make it to regular education as a regular education student. Okay, but if we wait too long to get started, the possibility of that happening is evaporating very, very quickly. And so that's why I always tell parents, if you have any concern whatsoever, it would be prudent for you to take advantage of, let's start providing some extra services to the child. And if they're no longer needed very quickly, great. You've made a decision which was still in the child's best interest. But if you wait, and this is where I've seen many children who said, well, we just thought it was all going to go away, What happens is those children are harder to work with, because now the child has learned that they don't have to do a lot of things that other people were expecting them to do. And so then you have a much, much harder time, because they've already learned how to manipulate the world to suit their own needs, when we could have worked with them earlier to get them to interact with others in a way like other typically developing children are doing. So again, the problem of diagnosis is not getting kids into treatment early enough, even if it's suspected that there might be a delay. If it's suspected, get it going, because you can always stop the treatment. But if you don't start the treatment, you might never be able to help